Hi everyone, I'm Matt Murphy, Tour Program Supervisor at Eastern State. Thanks for joining me again for another tour and discussion centered on prison healthcare. Today we are focusing on health outcomes for the incarcerated. What toll does incarceration take on a person's health? We're going to examine the history of Eastern State and look at some modern research to see if we can draw a conclusion. So as always, feel free to ask questions or make comments in the comments section as we go along, and I will try to get to some of your comments at the bottom, at the end. So in the 19th century, Eastern State was a world famous penitentiary with a radical idea that people who broke the law could be reformed through solitary confinement, labor, and moral instruction. The prison was very controversial, and the merits of the Pennsylvania system, as it was known, were intensely debated all over the world. Supporters of the system believed that isolation was a humane alternative to physical punishments like flogging somebody or putting them in a pillory. Others thought isolation a more severe and sinister punishment. Critics believed isolation would have negative health consequences for prisoners of Eastern State, and this was probably the most common criticism of the institution. Undoubtedly, Eastern State's founders wanted the building to be a sanitary and healthful institution. Eastern State's location and design were an attempt to improve upon the disease-filled prisons that came before. This is a picture of Newgate Prison in London, England around 1818. It gives you a pretty good idea of what an early 19th century jail was like in the United States. And there was a jail just like this in Philadelphia in the early 19th century. In the late 18th century, it was called the Walnut Street Jail. It was right at 6th and Walnut Street, across from what we call Independence Hall. The appalling conditions of the Walnut Street Jail helped in part to inspire the construction of Eastern State. Eastern State opened in 1829, about a mile and a half outside of the city, on a plot of land that was known as Cherry Hill. And this place was thought to be healthy and full of fresh air and away from urban squalor. The architect, John Havlin, designed each cell to have running water, to have flush toilets, and he was trying to create a sanitary environment for life in isolation. This was a huge engineering achievement in the 1820s. Eastern State was one of the most expensive public buildings in the United States at the time. Prisoners got an hour of fresh air and exercise each day by walking around in solitary exercise yards that attach to the back of the cells. We can see them in this picture here. So you have to recognize implicit in the idea of reform, the goal of reform was that prisoners would leave the building healthy enough to succeed in free society. So was the prison a more healthful institution? Was it better than other prisons? It's hard to say. There's conflicting evidence. It's hard for our historians to tell. In the first annual report for Eastern State for the year 1829-1830, the prison's first doctor, Franklin Bache, who actually happened to be a great-grandson of Benjamin Franklin, provided a generally positive review of the health of the prisoners. Quote, "The prisoners thus far have been favored with a good share of health. Some have acknowledged an improvement in their health, while others have evidently been rendered less robust. These contrary effects are to be explained by the different conditions in which the prisoners arrive," end quote. So Dr. Bache assigns poor health outcomes to pre-existing conditions. He also suggests that the health of some prisoners may have actually improved during their time at Eastern State. Bache was forced, however, to report on the first death at Eastern State, a man named Jacob Overholt, number 19. This is the cover of the prison's death ledger, where all deaths were recorded. On the first page, we see Overholt up at the top, not recorded by name, but number. Bache wrote, "Only 2 cases of serious indisposition have occurred, but 1 death. The fatal case was that of a prisoner of intemperate habits who arrived in a diseased state, having but recently suffered from a severe fit of illness in the Arch Street prison." So we're seeing the beginning of 2 recurring themes in the physician's reports, attributing poor health to alcohol consumption. That's what he means when he says intemperate habits, and time spent at other prisons and other institutions. Overholt's death is actually recorded as consumption, which was another word for tuberculosis, the #1 killer at Eastern State. I also want to point out that the death ledger, like most Eastern State records, is broken up by race, a column for Black and a column for white. We'll come back to this in a little bit. Now, mortality rates are one of the main ways we can look at health outcomes for people at Eastern State. Deaths were usually well recorded in the prison's death ledger. The doctor gave a report at the end of the year on who died, what they died from, and any treatment courses sought. They would usually compare total deaths to the average population to create a mortality rate. But it's harder to look at things that didn't result in death. A prisoner's life before and after Eastern State are mostly unknown to us, making it hard to tell how they fared health-wise. This is from the 1836 annual report. Dr. Beisch provided an analysis of mortality rates for the prison's first 7 years of operation. 24 prisoners had died by that point, with an average yearly mortality rate of 3% by his calculation. Beisch provided some comments on the numbers. Quote, "Upon the whole, this is a low mortality for a prison." In the same statement, though, Beisch recognizes that prison at its core is bad for a person's health. Quote, "All confinement and restraint are necessarily unhealthy, especially to criminals, in whom, for the most part, the vicious and depressing passions are constantly operating as a remote cause of disease. Whenever confinement improves the health of convicts, it is by substituting less healthy influences for those to which the criminal subjects himself by his vicious courses." Beisch brushes up against something that we know to be true today. Sometimes a person's health does improve in prison because they become unable to abuse drugs or alcohol, they get sober, they have a health condition diagnosed by medical staff, and they start a treatment course for that condition. In 1843, an alarming trend was documented at Eastern State. It seemed that Black prisoners were getting sick and dying at a far higher rate than their white counterparts. A study was published by doctor and ethnographer Benjamin Coates, who's pictured on the left. He served as an official visitor for the society that founded Eastern State, the Philadelphia Society for Alleviating the Miseries of Public Prisons. Coates took the prison's published mortality rates, broke them down by race, and compared them to Philadelphia area mortality rates, and his suspicions were confirmed. Coates found that Black prisoners had an average 7% mortality rate, about a third higher than the mortality rate for Black people in the Philadelphia area in general, and 3.5 times the mortality rate of white prisoners. In 1838, a very bad year, mortality was 11.8% for Black prisoners, but only 2.9% for whites. Coates, unfortunately, doesn't offer much useful insight into why this was happening. He instead goes on a long racist tirade about the differences between the races. Decades later, prison officials continued to support the Pennsylvania system as a more healthful system of incarceration. In 1872, Richard Vaux, president of the Board of Inspectors and a one-time mayor of Philly, wrote a brief history and analysis of the prison. In it, he wrote, quote, "On the contrary, it is my belief that less bodily indisposition and less mortality will intend separate confinement and imprisonment upon the present method." 25 years later, Vaux's friend and warden of Eastern State, Michael Cassidy, published another book about Eastern State. And the book contains transcripts from speeches and talks he gave at prison conferences around the United States. And in Chicago, 1884, he was talking in front of an audience, and a member asked him point blank, "Does not solitary confinement affect the health of prisoners?" He answered, "They go out enjoying better health than when they came in." He's also asked about the mortality rate. Cassidy answers that 16 in 1,600 prisoners passed away, or about 1% of the population. Prison officials often recorded prisoner health outcomes that didn't result in death in very simple but also confusingly unclear terms, like improved or cured, not giving us a lot of insight into how they were actually doing. This 1906 hospital report gives us a look at some of the common problems the doctors dealt with and the outcomes they recorded. We see a lot of typhoid fever. We know that the water was untreated at that point, and there was an effort to get prisoners to not drink from the tap in their cell, but rather to drink boiled water that was provided for them. We also see melancholy or depression, different forms of tuberculosis, and a lot of indigestion. This is a cartoon drawn by a prisoner who went by the alias Frederick Funk. And in this cartoon, we see a prisoner laid up in his bed. The thought bubble over his head says, "I've been sick all the afternoon. It's my stomach. The food made me sick." And he's got prison officials looming over him, threatening him with an ice bath in the hospital if he doesn't get up and get to work. This is another Funk cartoon. This time we see prisoners out in the yard in a big group, and there's overflowing garbage cans and refuse piles and dead rats everywhere. A bunch of the prisoners are holding their nose, trying to block out the stench. One guy is saying the Board of Health should be notified. Moving into the mid-20th century, healthcare seemed to really improve at Eastern State. Eastern State built a hospital in an old cell block 3. They added modern facilities like x-ray machines pictured here, a large corps of doctors from local Philadelphia hospitals. They implemented better sanitation and hygiene. To date, the historic site knows of about 1,500 deaths in the 142-year history. But that number is actually slowly growing as our research continues. This is out of roughly 85,000 people to come through the building as a prisoner. Now, today, modern scholarship has provided us greater insight into the health impacts of imprisonment and the relationship between criminal justice and public health at large. According to the Prison Policy Initiative, people in prisons and jails are disproportionately likely to have chronic health problems like diabetes, high blood pressure, cirrhosis, hepatitis, HIV, substance abuse disorders, and mental health problems. Despite all this, correctional health care is usually low quality and difficult to access. Most states require prisoners to pay for co-pays out of their prison jobs, which usually pay below the minimum wage. This chart shows state by state the percentage of a prisoner's monthly earnings that they would have to spend to pay for one copay. In 7 states, it's more than 100% of a monthly wage. A 2016 study found that every year incarcerated results in a loss of 2 years in life expectancy. About 2.2 million people locked up. The study's authors believe that 5 years has been lost from average US life expectancy. So a different kind of impact from mass incarceration. Healthcare for women is especially bad in US prisons. Women are the fastest growing section of the US prison population, and they live in a system generally designed for men. Prison systems consistently fail to meet national standards for prenatal care and nutrition for pregnant women. A 2017 study found that 5% of women admitted to local jails were pregnant. Access to healthy food and nutrition is difficult in prisons, further complicating things. A study done in Washington State found that the Washington DOC's food quality was so poor that it actually constituted a public health problem. People over 55 are one of the fastest growing parts of the prison population. Prisoners over 55 are more likely to have a chronic health issue, and it costs a lot more to incarcerate them. Public health experts continue to look at the relationship between health before, during, and after incarceration and the outcomes for people who get out of prison. Evidence continues to mount that folks inside of prisons often come from communities with poorer health. This graph shows that communities with high rates of incarceration also tend to have high rates of youth asthma, just as one example. And people with disabilities are dramatically overrepresented in the US prison system. According to the Bureau of Justice Statistics, prisoners are twice as likely to report having a disability. When you're looking at jail populations, it's almost 3 times as much as the general population. So obviously, this is a very complex topic, and it's hard to tell the whole story in such a short format, and we don't want to be reductive. So I think I'll wrap with some questions for consideration. When someone's sentenced to prison for a crime, is it fair to expect negative health outcomes? Is that part of the punishment? Or is this an unjust and unnecessary side effect of the criminal justice system? Communities with poor general health tend to have higher rates of incarceration. What does that say to you? And how can that information help address both issues? Poor health is also linked to recidivism. How can prison systems use good healthcare policies to serve public safety? So let's see if we have any comments in the chat. How does outside public health impact the health of prisoners incarcerated today? Yeah, so I think we talked a little bit about this, but in general, often people entering prison in general are in poorer health than the general public. And going into prison may cut them off from critical services that they need. This is especially true for people who are disabled. How did ESP get so lucky with hospital records? The hospital records are kind of a mixed bag. We don't have a lot of records around, say, exact surgeries, when they happened, who they happened to, but the annual reports, which were published all the way into the mid-20th century, are pretty exhaustive. The prison published reams and reams and reams of tabular data, and the annual report always included a report out from the doctor, sometimes even the dentist too. Well, it looks like that's all the questions we have. You can, of course, ask questions after we wrap, and we will be sure to get to them after we close for the day. So if you want to stay connected to Eastern State in the meantime, there's lots of ways. Facebook, Twitter, Instagram, and our website's really great, easternstate.org. All right, have a nice day and stay safe out there. Bye.